Hi, I'm Aliya, Occupational Therapist. Let's discuss your child's eating and feeding habits.
From 0 to 5. It starts at home. She's like, home. She's like, home.
The first thing is to think that when we want to encourage oral motor development, we want to encourage chewing, swallowing, and that comes with developing the muscles of the face. One thing to do if your child is using a bottle, to stop using the bottle. That does nothing to develop the cheeks and the jaw muscles that you will need for chewing. So if your child does still need to drink most of their nutrition, you can move on to using a cup or move on to using a straw so that they can get some of that muscle development going. Another thing you can do is play. You can blow bubbles. Bubbles, you can find bubbles at home with a dishwashing liquid, put it in a cup, get a little bubble holder or use a straw to blow the bubbles. That's really going to work the muscles of the jaw, and it is fun. The entire family can get involved. Another one for our Caribbean people that we all know is making monkey face. Don't underestimate the power of these things that might seem silly and how much of a benefit they can have on development. Just making a simple fish face, trying to pucker your lips, trying to pull your cheeks in together, that is doing a world of good to developing the muscles that you will then need to eat and to speak. If your child is eating only one texture, you can gradually introduce a new texture. If your child is only eating crunchy foods, you can try to find a food that's similar to what they already eat, but maybe not with so much crunch, and present it a tiny bit at a time, but also give no pressure to try. If they don't want to try it today, they may try it tomorrow. If they see you eating it, they may want to try it as well. And another point for increasing that oral motor development around the tongue and the lips is to put small bits of food or yogurt or pudding around your child's lips or their mouths and encourage them to use their tongues to lick it off. Similarly, if it's on a spoon, you can encourage them to close their whole mouth around the spoon first before you take the spoon out. A routine is very important for meal times. One thing that a routine does, it helps your body know when it's hungry. So if you have a consistent time where you eat breakfast, lunch, and dinner, then your body starts to adapt and it knows when it needs to eat. So for children who may have some sensory differences and they don't feel hungry, having a routine can help that child better understand their body cues and understand when it's time to eat food. Having a routine also helps with your digestion. When you have a consistent breakfast time and consistent meal times, it can help the food digest a bit easier, and it can also help with bowel movements for those children who may also have some difficulties in that area with not being potty trained as yet. Although eating at a table might be ideal, that might not be practical for everybody, and that is okay. What we want to think about with positioning is just making sure that your child is upright, making sure that the airways are clear so that food can go down, and making sure that they are in a position that would allow the food to pass from their throats into their stomach without much obstruction. So if we can't sit at a table, we just want to make sure that when they're sitting, they're nice and upright and not moving around too much, so that we can get that food digested a bit easier. Apart from the routine, one of the top tips I can give to reduce mealtime stress is to have a family mealtime as much as possible. While this might not be feasible for every family, if your child who has an eating or feeding concern can at least see one other person enjoy a meal or have a meal, it might pique their curiosity. They may want to see, oh, what is my brother or sister eating? And they may then want to try it for themselves. So as much as possible, try to establish a family meal or a meal with your child at consistent times throughout the day. The next step is to reduce the pressure to try new foods. I know as a parent, you want your child to be eating because obviously there are concerns with health, but when introducing new foods, introduce a tiny bit at a time in a separate container, maybe a spoonful of food at a time that the whole family is eating. You can introduce it on a separate plate, in a separate cup, a little spoonful, a little bite, but also give no pressure to try. You may have to do this consistently. Today they may not want to try it. Tomorrow they may touch it. The next day they may want to smell it. Give them the opportunities to explore these new foods on their terms so that when they are ready to try it, they feel safe and they may be in a better position to want to eat that new food. The final tip with reducing mealtime stress is to have fun. We can develop so many eating and feeding skills outside of the actual eating and feeding. We can play in the sand, we can do scooping, we can take a knife and cut sand, we can cut Play-Doh. You can have your child make dough and make their own dough by pulling and stretching, making letters. So do all of these things outside meal times because when you come to eat the food, your child will already be used to different textures and they will have these skills developed for eating and feeding.
I feel like I'm going off my mind. My mommy told